Hi, everyone. My name is Amanda with NFP's Medicare department, and we are going to just go through a Medicare 101 presentation. As you jot down some questions, there will be an email and a phone number that you would be able to use to contact us going forward to help you with more details. I'm going to turn my camera off, and we're going to go through the presentation. Okay, so things that we are going to talk about today. We're going to first talk about what Medicare is, where do you get it, when do you enroll. We're also going to talk about the difference between an Advantage versus a supplemental plan. We're going to talk about prescription drugs, which is also known as Part D, and also the extras like dental, vision, gym memberships, hearing, things like that. And then just some tips and tricks so that there is no penalties that you incur with your Medicare as you move towards 65. Original Medicare is what you get from Social Security. Medicaid is not the same. Medicaid is income-based, whereas Medicare is age-based. So original parts A and B will be given to you once you turn 65. You will also qualify for Medicare if you've been deemed disabled by Social Security for up to 24 months. You can sign up during your initial enrollment period, which would consist of 3 months prior to your 65th birthday month, that entire birth month, and 3 months after your birthday month. You only are auto-enrolled in Medicare Parts A and B if you are collecting Social Security prior to turning 65. So most people will have to initiate enrollment into Medicare's A and B. Those that are disabled and after 24 months are auto-enrolled. So those people who get Medicare prior to 65 will not actually have to do their own enrollment. You'll get a card in the mail once that 24 months has lapsed. You can sign up in person or by phone, but the easiest way to do enrollments are online, and it is something that we can assist with. If you are still working and you are turning 65, but you are full-time and the company you work for is over 20 employees, you will be able to sign up for Part A as an apple, but you can defer Part B. That's the part that you pay for, Part B as a boy. If those things do not apply, if you're not full-time, if you're not currently an active employee, or your company is not over 20 employees, you would need to enroll in both the A and B in order to continue on the company insurance. And as soon as you go to COBRA, it does not matter how large the company is. As soon as COBRA kicks in, your Medicare A and B, if you're eligible, will be considered your primary insurance. So if you are looking to retire, we will need to get you Medicare A and B set up prior to you wanting to start that insurance. We always try to see and look about 2 to 3 months prior to when you actually need Medicare to start. Here are some of our eligibility periods. So there's something called the IEP, or the initial enrollment period, and that's when you initially turn 65. If for whatever reason that you don't need to sign up for Medicare when you first turn 65 due to workage, or if your spouse is working, there are also special enrollment periods, SEPs, that we can help use throughout the year. There's no specific dates. SEPs can be used throughout the year. There's also a general enrollment period. So if you miss your window to sign up for Medicare and you do not qualify for any special enrollment periods, there is a point in the beginning of the year from January 1st to March 31st that would allow you to enroll in A and B, but penalties may apply. Again, this is something that we're going to be able to help walk you through. Most people are going to be eligible and do things within their initial enrollment period or through a special enrollment period such as retirement. Let's dive into the parts of Medicare and what they cover. So Part A is your hospital coverage. As long as you've worked 40 quarters or 10 years of your life, Medicare Part A will not cost you anything. Everyone who turns 65 should enroll in Medicare Part A unless you are in an HSA type of insurance policy. So if your company's coverage is with an HSA, then we will not enroll you in Part A. But as long as you are not in that type of plan, you should be able to be in Part A and have that when you first turn 65. And essentially, Part A is going to help you with your inpatient hospital, some skilled nursing, hospice, and home health care, and most likely will not pay because of your company insurance is normally better than what the government says you have to pay out of pocket. The other part of Medicare that you get from the government is Part B as in boy, and this is your doctor's coverage. So you can think of your doctor's surgery visits, doctor's office visits. These are also going to be your testing. So any MRIs, CAT scans, x-rays, lab work, durable medical equipment, mental health therapy, also physical therapy, occupational therapy. The big section of your Medicare coverage is going to be covered under Part B, and Part B does cost you a monthly charge. The median charge for 2025 is $185 a month per person. That's what the government says that you should pay. Some people, based on their income, may pay more, but that is something we'll be able to talk to you about in a more one-on-one situation. Everything else that we talk about today, other than the A and B, are going to be something that you need to purchase on your own. So A and B, again, are through Social Security and our government. And then everything that we talk about going forward are the plans that you are going to decide to enroll in. So there is a type of plan called a Part C. This is also known as an Advantage plan. And these are offered through private insurance companies. And the types of plans these are the HMO, PPO type of plans. So with the Part C Advantage plan, your Medicare is no longer your primary insurance. So that A and B are not going to be your primary insurance. These Advantage plans that you enroll in become your primary insurance because you must use the carrier's network of hospitals and doctors. They can change these networks throughout the year, and you're locked into your Advantage plan for each calendar year. These Advantage Part C plans may also include prescription drug coverage. They also can include some extras like dental, vision, hearing, gym memberships, but they also will include deductibles and copays for everything. So they will allocate different out-of-pockets for every procedure, including specialist visits, surgeries, hospital stays. Part D prescription is going to be how you're going to get your prescription drug coverage covered. You're able to get a prescription drug plan with an Advantage as a full package deal. So that Advantage Part C would include prescription drug plan. You'd be able to get your Part D plan as a standalone prescription only type of policy, or some Part D plans are through your retiree coverage. So depending on if your company offers that type of coverage. Each prescription drug plan differs based on your zip code. Every plan has a different set of medications that it covers. And each stage, each plan goes through the same stages every calendar year. So in 2025, most plans will make you pay the first $590 towards your medication cost, and then copays of up to 25% kick in. This year, Medicare decided that there is an annual maximum out of pocket for all your copays. Once you hit that $2,000 that you pay out of pocket to a pharmacy, you will have all your medication costs covered in full for the remainder of that calendar year. We'll also be able to help you make sure that you do not get any late enrollment penalties depending on when you enroll. There is some paperwork sometimes that does need to be responded to in order to stop any type of penalties to being assessed to your account. We're able to help you with a list of your medications, and preferred pharmacies find the exact plan that works best and gives you the least amount out of pocket for the year. These prescription Part D plans, as well as the prior Part C Advantage plans, can only be changed between October 15th and December 7th every calendar year. Those new plans that you choose during that time will not take effect until January of the following year. In 2025, the government added a $2,000 out-of-pocket cap for your prescription drugs. Going forward, that will remain the same, but in 2026, it will be $2,100 as your max out-of-pocket. Starting in 2026 with the Inflation Reduction Act, the government is going to also start negotiate prices for some higher cost drugs. So you'll start to see in the news the list of medications for 2026 that the government is looking to negotiate, and hopefully we'll see those savings as you go to the pharmacy in January of 2026. Instead of getting a Medicare Advantage Part C plan, you also could opt into having a supplemental coverage. These are the type of supplemental plans that are available, and the most popular plans are Plan G and Plan N. Those plans are the same coverage nationwide and will help limit your out-of-pocket for medical purposes. For example, a Plan G in 2025 would not make you pay any more than the $257 Part B deductible for the year, and then everything's covered 100%. We can work on pricing based on your age, gender, and zip code, and that is something we can do it on a one-on-one situation. Let's talk about the difference between an Advantage and having a Medicare supplemental plan. The first thing is you need to have A and B with Social Security and pay your Part B premium no matter what type of policy you go for. So within Medicare Advantage, the Medicare Advantage plan that you choose with whatever company, they would become your primary insurance. These plans again restrict with networks for providers, hospitals, suppliers, and where you can go. They also dictate the different copays and your out of pocket. Most maximum out of pockets can range anywhere from $5,000 to $8,000 a year. Some Advantage plans also offer prescription drug coverage included, as well as dental, hearing, vision, and some fitness benefits. With the Medicare supplemental plan, your Medicare A and B are primary. This is going to allow you to use every hospital in the country and any doctor that accepts Medicare, which is about 90% of all the doctors within the United States. Medicare supplement plans would pay as secondary. So as long as the doctor or hospital accepts Medicare, you would be able to go. There is no additional network depending on what company you choose for your supplemental plan. And you would have to enroll in a Part D prescription drug plan separately, since Medicare supplemental plans do not cover any type of prescription drugs. You would also have to decide on dental and vision separately, and you can add those as you need. Dental, vision, and hearing are extras that we can help add for your Medicare coverage. Dental and vision and hearing are going to be specific to the provider that you see. So these types of plans all do have networks. So we'll be able to dive into exactly what dentist and eye doctor you use to be able to find you a plan that will help you get coverage to where you like to go with your preferred providers. We also offer some final expense coverage for funeral and burial cost coverage. We also do cancer. So there are cancer policies that you can purchase if you have cancer in your family or any type of family history. It is something that is a great policy in case something were to happen. You do get a lump sum of money that you can then use towards anything, whether it's final vacations, cost of travel to get treatments, anything that you would personally like to use it for. When going back to Medicare and the type of plan that you're looking for between Advantage and supplemental, there are some things that I think is important for people to consider. So first you have to consider premiums versus your out-of-pocket expenses. So the Medicare supplements are more expensive, but they have less out-of-pocket when you go to use the insurance. So we would have to look at your usage, your health history, and what you're looking for in terms of choice of doctors to figure out what plan would be your best option. There's also lifestyle factors we should look at, and has to do with, are you traveling often? Do you have dual residence where we need to make sure plans work in two specific states? What is your health history with your family? Do you have any chronic diseases? And then also, what's your risk level? Do you prefer having a lump sum of money that you have to use in case you need it? Or do you like to know that if you pay this much each month, you only have a set out-of-pocket expense for the year? So there's different ways in which we can help determine what plan might be the best option for you. We're able to help you gather your doctors, your medications, your preferred hospitals and pharmacies. We're going to do a complete an overview and evaluation of what Medicare policies are offered to you, and then see which ones might match your lifestyle and what you're looking for coverage wise. We offer multiple carriers. We're in all over the country in any state, so we'll be able to assist you. So please just give us a call. And again, we help you with enrollment, working with the Social Security office, applying for the A and B, as well as helping you going forward every year once you do enroll to make sure those plans are up to date and that is the best policy still for you. I'm just going to hold this here. You might want to hit pause. This is our 1-800 phone number for Team Medicare here at NFP. as well as our teammedicare@nfp.com email address. That Team Medicare does look like there's a space in there, but it is just one word, teammedicare@nfp.com.